first case of infection of the coronavirus in India was reported in Thrissur, Kerala. The COVID-19 pandemic, which originated in the city of Wuhan, China, has quickly spread to various countries, with many cases having been reported worldwide. Infections caused by these viruses are an enormous global health threat. They are a major cause of death and adverse socio-economic effects. Here is how it affected the socio-economic rights in India.
Economic, social, and cultural rights are socio-economic human rights, such as the right to education, right to housing, etc. Socio-economic rights are recognized and protected in international and regional human rights instruments. It is likely that the COVID-19 pandemic has long-lasting consequences on economic and social rights, stemming from the direct and indirect effects of the illness, people's cooperation with prevention efforts, and government transmission control policies. The pandemic has also starkly exposed economic inequalities. The COVID 19 crisis calls for rebalancing of efficiency and resilience throughout the economy. The social economy can develop a much larger role to inspire transformation to a more inclusive and sustainable economy and society. What were the challenges faced by you or people of your profession?
The biggest challenge was shifting from a real classroom scenario to online mode, wherein there were a lot of technical glitches, and I guess, we were not really equipped to deal with such a scenario.
How did you overcome these challenges?
Um, I guess with the help of the IT team from our institution, wherein we were given frequent trainings with respect to how to handle, online classes, various inputs, and also certain softwares which really supported the online classes. I think all that helped, and also I think the kind of rapport that you have with your students, when they feel that you are approachable as a teacher, I guess they feel free to tell you about if they have any concerns. And secondly, I guess the students who were like, in remote places, or those who didn't have much access to, internet connection, what we did was like we recorded our classes and made sure that, these reached them at some point so that the learning process did not get disrupted.
Now, let us look at the impact of COVID 19 on the socio-economic rights. The Indian government implemented total lockdown from 25th March 2020, which included a travel ban and had a sudden adverse effect on jobs. The worst affected sectors by this were hospitality and transportation. While regular permanent employees would continue to receive salaries during the lockdown, the daily wage earner and unskilled laborer earnings were severely affected. UN treaty bodies have set out a minimum core obligation on countries, meaning the basic rights they should ensure at all times for everyone. Right to an adequate standard of living of the people was also affected due to COVID 19. People without adequate housing are at higher risk of contracting COVID 19. People living on the streets, in shelters, or crowded settlements are particularly vulnerable. Due to the COVID 19 pandemic, access to education has been hampered. Many students across India also rely on schools for the midday meal scheme.
Discrimination against medical staff. Doctors who had taken to social media to raise concerns about the shortage of safety gear have faced a backlash. On the grounds, doctors, nurses, and medical support staff face challenges that range from prejudice from neighbors who think they have been exposed to the virus to harassment by landlords. At work, they put in longer hours despite a shortage of protective gear such as gloves, masks, and coveralls, even as they grapple with the crippling fear of carrying the infection home to their loved ones. Hardships of migrant workers. A significant chunk of the Indian population migrates from their villages to different states and cities in search of employment and work, largely in the unorganized or informal sector. It is humiliating to become a kind of refugee in one's own country and have negligible social security. Right to health. A rights respecting response to COVID 19 should ensure that accurate and up to date information about the virus, access of services, and other aspects of the response to the outbreak is readily available and accessible to all.
How did the pandemic affect your daily income?
COVID has really affected all the profession. it includes doctors also, because the patients have fear of COVID, and so the patient coming to the clinic has been very low, and because of that, the income has come down, and because of that, maintaining the clinic and giving the salaries, everything is very difficult.
What were the challenges faced by your colleagues or the people of the same occupation as you?
The challenges what the doctors have to face is how to open the clinic during the pandemic, and it affected not only our life, the our family also.
How did you overcome these challenges?
So overcoming challenges means we have not yet overcome the challenges, because challenges are there, and even the third wave is coming, and again same difficulties, because we have to how to maintain the clinic, how to see the patient, all that is there. But hope it will change within this year, and everybody will be fine, and hope this the normalcy will come back soon.
There are several policy responses governments could follow to immediately assist all those who need access to health services and social protection, particularly in low and middle income countries. Assistance can take the form of expanding coverage in existing social protection programs, and which should be developed in consultation with a wide range of civil society groups. Social and economic assistance should be directed towards those at greatest economic risk due to COVID-19. This support should include informal and undocumented workers, including domestic workers, migrant farm workers, street vendors, immigrants, etc. They are most at risk of falling into poverty, and it is important to protect their livelihoods. Their exclusion from social protections often violates their right to social security.